Hey everybody, we are here with Dr. Ben Dobbs, which if you remember was on our podcast a while ago because you have recently opened, I know it's behind us, but I'll let you go with it.
Yeah, True Addiction and Behavioral Health.
All right, and where are we located? What's that?
Murfreesboro, Tennessee. We're right off of Middle Tennessee Boulevard.
All right, cool. And if you wanted more information about the podcast, I'll link that below. But you were gracious enough. It's one thing to hear about it on the podcast. It's another thing to see your office. And you were nice enough to let us come in and give us a little tour because this is one really nice office, y'all. So feel free to lead the way. I was going to say, can we start with the conference room over there?
Yeah, absolutely. Right. This is a reception desk. And then right over here is our conference room. It's where we have our morning clinical meetings and afternoon meetings as well, strategy and planning.
This is one nice conference room. You guys put a lot of effort in it. Didn't you say your wife is a designer?
Yeah, so she did all the interior design here too as well.
Shout out to his wife. She did a good job.
Yeah, thank you.
Then, so back out. So this is the main lobby.
Yep.
When people come in.
Yeah. So most of the time the families will hang out here until we're ready to bring them back and or any people coming in for client interviews and stuff, yeah.
Okay, so then we go back here. So you have, what's to the left over here?
So the clients would walk in this way and they would come into here, into the admissions room. This is where they go through the full extension, a pain screen, nutritional screen, any daily living screen, risk management screens, as well as their consents. We take their weight, we take their vitals, just to make sure everything's stable. And then we go through that whole process, and then next day we go to the room next to them and see the medical team.
One thing about this room though, it looks very comforting.
Yes.
Like, it looks like you fall asleep in that chair.
Those chairs are very comforting, yes, absolutely.
Nice. Well, you know, especially for people checking in for the first time going through it, I imagine it takes a lot of the edge off.
Yeah,
so
absolutely. Really everything that we've done here in design was intentionally thought of.
Okay.
Even to the point where we held out on some of our pictures, we were able to get an admit one ticket.
Very cool.
Yep, for our admissions room, yeah.
I like that, very cool.
Yeah.
So what's next door? We got another room over here?
So right next door is our medical office. And this is where the clients come in, they meet our nurse practitioner, our psychiatric nurse practitioner, and they'll do an evaluation of a history and physical with them, trying to get their background of some patterns and everything like that, their history, medically and physically, and cognitively, mentally, and emotionally. And then they go into a psych eval as well. And so that usually the intake lasts about 45 to 60 minutes. All of our clients do see the nurse practitioner once a week after that.
Okay. Yep. And another thing, just like that other room, it's very, very calming. Like even the picture of the horse over there just kind of relaxes you when you come in. So
absolutely.
Very, very cool. So what else we got over this way?
So to walk through this way, we have the common lobby area right here. This is where the clients hang out in between groups, breaks.
Okay.
We do have a chessboard, so there's this chess pieces inside of here.
Oh, cool.
So usually we'll break down and play a little chess, listen to some music, and just kind of hang out in between groups and sessions. Yep.
Gotcha. By the way, I love this on the wall. What was the inspiration for this?
So we wanted to get something that was positive affirmations and big enough and large instead of just having the small pictures. Okay. Be able to put some something that was intentionally, so when they first walk in, they can see maybe they're doubting. Most of our clients would come in feeling hopelessness and doubting self-confidence and self-worth.
I gotcha.
So we wanted them to know where we stand on that and also to let them know they are enough and they will be loved and treated worthy here.
I love these two right here. You are loved, you are worthy.
Yeah, absolutely.
You hear that, everything? Awesome. After you. What's down this way?
So down here we have a break room. This is where clients can hang out during lunch. There's also snacks over there. We keep snacks for them throughout the day. And we program differently. Some clients only come for 3 hours in the morning. Most of them will head out. And then some stay with us for about 5 or 6 hours throughout the day, Monday through Friday. And they will have, this is where they eat lunch and stuff like that. Yep.
How about this room?
This is another therapist flex office. So some of our clients, let's say they can't go up the stairs. So upstairs is kind of what we've deemed it clinical row.
Okay.
That's where all the therapist offices are.
Gotcha.
So we kept this as a flex office for maybe someone struggling with back pain, legs or anything like that. If there's a group going on and maybe they want to meet someone down here, they can do that as well. So
again, another very comforting room. Like even the lights, like they're very,
absolutely,
just a very calming room.
Yeah,
a lot of effort you guys put into this, you can tell.
Absolutely.
Very cool.
Yep. Thank you.
What we got out this way?
So in here is just a little kitchenette, and you gotta have coffee. Anything in treatment has to include coffee. We keep them awake and everything. We have an ice machine, so this way here, if they want any drinks that they bring in, they have access to that. So,
wait a sec, is this the Sonic ice machine? It does the little round.
we haven't gotten there yet.
Oh, okay, it looks
I
very
know exactly
close.
what you're talking about. Yep.
That looks really close. That's awesome. Okay.
And then this is the executive office. It's my office.
Okay.
So, and again, just more calming and stuff. I do meet with clients. I carry a small little caseload, so we'll come in here and do sessions as well.
Okay.
So,
Awesome.
yeah.
It looks like we got, what, one more room down here?
So, this is the group room.
Okay.
I kind of like to say this is where the magic happens.
I got you.
And what we mean by that is this is where they do all their clinical group sessions, and they're in here from 9:30 to about 12:15. There's some breaks in between.
Gotcha.
But we do, a lot of us in our clinical staff,
Okay.
we all use the whiteboards. We
Yeah.
teach cognitive behavioral therapy, dialectical behavioral therapy,
Okay.
coping skills, and those type of things. And then we also utilize the TV for TED Talks, informational lectures as well.
Very cool.
Yeah.
I got you. Now you said upstairs was a clinical row.
It's clinical row.
Is that something we can show? Or
Yeah, absolutely.
Oh, can we? All right,
have
cool.
right
Let's
up
go
there,
upstairs.
So another kitchenette, we try to keep this staff only.
Okay.
And then this is another group room. So we do, Wednesdays is mostly when we use this room.
Okay. Oh, big room.
We use virtual, so
Okay.
we have our clinical director that does virtual groups on Wednesday. And then also this is where they do meditation and yoga.
Oh, very cool.
Yeah, so that's why the chairs are that way. We'll pull them out.
Yeah.
Very accessible, they're all on wheels. They'll fold them out, they'll do the first group.
Yep.
And they fold them back, and then this is where they do their meditation and yoga on Wednesdays.
Yeah, this is a pretty good, I don't know if the camera can capture it. This is a pretty good sized room. So.
Yeah, this is
very
the
cool.
biggest one in here. So.
Oh, is it? Okay.
Yeah.
I got you. What else we got up here?
So, and then this is just the clinical offices, where we have therapy offices on this side
Okay.
as well, all uniformed.
All
That's
right.
one of our therapists, Kelly.
All right. Of course, we catch everybody in their work. Sorry.
Yeah.
All right. Very cool. Even up here, dog. God. Y'all's offices are so nice.
That's Bobby, another therapist that we have here.
All right. All right. Well, there you have it, everybody. There's a quick tour, and thank you again, Dr. Ben, for
thank you.
giving us this tour. And one more time, shout out where you at, how can people find you, your phone number, all that stuff.
Yeah, so True Addiction Behavioral Health, we're located at 730 Middle Tennessee Boulevard, right here in Murfreesboro. Phone number, they can reach us on our website.
Okay.
The numbers constantly, we rotate different numbers
Okay,
as well.
gotcha.
So,
What's your website?
it's going to be trueaddictionbh.org.
Awesome. We'll link to that in the description so they can find you.
Absolutely.
And then, as always, we appreciate y'all watching. If you have any questions on anything you saw or for Dr. Ben, put them in the comments below, and we'll get to those as soon as we can. And we'll see you on the next one. Thanks, guys.
Take care.